The opinions expressed on Plastic Fantastic are intended for educational and informational purposes only and are not meant as a diagnosis, treatment, or substitute for professional medical advice. The mention of any product, treatment, or procedure on the show does not constitute an endorsement or recommendation and is purely for the information and education of the public.
Welcome to Plastic Fantastic, a weekly show dedicated to the latest in plastic surgery, aesthetics, beauty, and wellness. Now, here are your hosts, board-certified surgeons Dr. Robert Silich and Dr. Olivia Hutchinson.
Good morning.
Good afternoon.
Good evening.
Good morrow.
Kind sir.
Good lady.
Welcome to the Plastic Fantastic Show.
With Dr. Olivia Hutchinson.
And Dr. Robert Silich.
God, it seems like we've been away for a long time, but I suppose it's only a week.
Is it the summer doldrums that cause this?
You know, that's a real thing.
Yes, it's a
Maybe
phenomenon.
You could explain it to the listener.
I can't explain.
I was watching some pirate movie, and in the bottom
expert.
it said, like, the doldrums. It's actually, It's a geographic area, right? Near the equator, I think?
Yeah, that has to do with no wind or something.
Yeah.
That's all I know.
So the question I have about the doldrums is it anywhere or is it a specific, like, longitudinal and latitudinal area?
Okay, so do I look like I have...
Well, you've had family in the armed services. I figured you would know.
I've been on a boat, too. Doesn't mean
there
that
you go. You took a cruise.
I did. Shall we talk about cruises?
We're going to talk about Summer Injuries, which is a great show.
This is the nasty, gnarly...
It's going to last about 6 minutes, and
gory.
then we're going to talk about food and drink. But
it's going to be summer injuries while you're cooking.
We're going to well, that's going to come up. That's probably the tangent where we'll run on. But we're going to at least kid ourselves that we actually have a topic to run with.
We always have topics and so much to say about each one.
But this is one that comes up a lot because we get lots and lots of calls, not for that emergency facelift, but...
Or emergency Botox.
Doc, I just got bit by my coton de Tuileries. Or my shark, my pet shark, my baby shark. Mike, do not,
horrible.
Mike, under no circumstances do I want to hear the clip of baby shark.
And I can't believe you actually used those two words in the same
I'm
sentence.
sorry. I didn't know what it was, and my nieces told me. And me, like an idiot, the uncle. That sounds cool. What is it, kids?
Yes.
Not.
Famous last words. What is it? We're already gone.
Topic change. Let's just get off it because it's not cool.
We're already on social media, but we're trying to steer clear.
All right, so summer injuries.
Steer clear, see?
Sailboat back on the boat.
Yeah.
I'm sailing. Remember, what about Bob?
We're sailing away. Where are we sailing to? Distant shores.
Takes me to where I'm going, Christopher Cross. Hit it, Mikey. You got to be barefoot or you have to have light rubber shoes on the,
so
the boat.
That they can grip. I guess it's the wood.
Oh, is that why? I thought you
slippery.
just, because you don't want to scuff the boat.
Well, you also don't want to fall off the boat. Depends who you are.
Coming about.
Shall we talk about Johnny Depp? And you said you watched a pirate movie.
It wasn't that. It was, maybe it was actually.
Do you know he was in a movie that I hadn't even heard that he made one so recently, but he plays some kind of, I think it's like set in India or something, and it has to do with like British colonial rule, and he plays some sadistic character. I just saw the trailer.
Like a period piece?
I guess, because I think it's around the turn of the century or the 20. I can't remember exactly, but
busy boy, that Johnny Depp.
But he looks strange.
It's pretty strange in court too.
He was pretty funny. Not to digress.
Let's cast aspersions on one side or the other in that fiasco court.
In that fascinating
trial of the century.
It was the Ollie North trial.
It was like
2022.
It was amazing.
Are we in 2022?
All the legal scholars must have been
yes, taking notes.
Loving it.
Yeah.
Anyway, you're listening to Plastic Fantastic with Dr. Olivia Hutchinson.
And Dr. Robert Silich, not ESQ.
We are going to talk about summer injuries because this comes up and we spend a lot of time fielding the phone calls and sometimes treating it. Yeah.
Yeah, sometimes, because not everything is an emergency, as you were saying. But some things require emergently to be treated, and they also can cause serious problems if not tended to very quickly. So something to keep in mind. Mm-hmm. Let's start with simple things.
Let's start with, I was going to go even one step back first. Let's start with, why would you involve a plastic surgeon? Well,
because you just like to hear their voice.
We're very close with our patients. They have our cell phone numbers. They will call us directly, or they'll call the answering service, but for the most part, they call us on our cell phones. Everyone wants to avoid the emergency room, and I get that. And a lot of times you and I get phone calls, oh, I burned myself at the barbecue, I got bit by a dog, I got bit by some kind of insect, I've got a rash, I've got a laceration, and to try and save people from getting to the ER, there's a lot of stuff that we can do to prevent that. And frankly, there's a lot of stuff we do in the office where people will meet us here after hours to do. So I think it's always a good idea somewhere in your Rolodex to have the number
Now you're dating yourself.
They don't have those anymore? I guess they don't. Probably just on the phone, right?
Yeah, your contact
What a
list.
loser.
In your contact list.
All right. You should have in your contact list somewhere, I am dating myself, the number of a plastic surgeon or a surgeon to avoid those long, horrible experiences in the emergency room.
Yeah, and the thing with the ER is that you never really know what you're going to find because by definition, these are emergencies that are unpredictable, unforeseen. And so it's not like you can say, well, if you just go there at 9 o'clock in the morning, chances are that you're going to be seen quickly. I mean, it's totally luck of the draw.
Yeah, and also chances are at the end of their workup trying to figure out what problem you have once you wade your way through the myriad of administration, they're going to call you and I anyway, or a plastic surgeon, and then you've got to track us down, drive into the ER. Much easier sometimes to do it directly.
And the nice thing is that, of course, we have an operating room here in the office, which means that we have access to very sophisticated equipment and instruments, and sometimes the emergency room is even equipped with the types of sutures that we need or the instruments or the material that is necessary when you're dealing with an open wound or a fresh injury. So always important to remember, find the specialist when you have something that could benefit from a specialist's evaluation and management.
All right, so right off the bat, so summertime, let's talk about, first of all, probably bug bites. That comes up a lot, right? The big one that we worry about
Not
here
so
in the
much
Northeast
I was going to say New York City, mosquitoes.
Mosquitoes, yeah, but the big one for us is tick bites in the Northeast, right? And everybody worries about Lyme disease, but there's also other ones that are very bad as well that come with the ticks. Not just Lyme disease. There's something called Borrelia burgdorferi, which is another infection that's carried by certain ticks. The bottom line is, I always advocate for most people that live in the Northeast, whether it's Connecticut, whether it's even New Jersey or farther out in Long Island.
Woody areas or places with deer and that sort of thing.
To keep an antibiotic with you that is the one with one dose will knock out possibility of Lyme disease with a tick bite. And that's doxycycline. And you really just need 150 milligrams. You need one pill or two pills. We're not trying to give medical advice out there, but...
Yeah, we're definitely not giving medical
We're really not, but I will give you...
if you have an allergy to doxycycline, definitely do not take doxycycline.
Well, here's the problem why doxycycline is a problem, too, in the summer, is it's sun sensitive, which means if you're on it, you really have to stay out of the sun because you'll get a very bad sunburn. I'm going to give you the inside baseball scoop that most doctors that I know in the summertime, they always have doxycycline around. Even if you think you got bit by a tick, but you can't find it or you're not sure it is or you can't get it off, one dose or two doses of it knocks it out in 24 hours and you don't have to worry about it. Ideally, you want to catch the tick, you want to save it, you want to bring it to the doctor or bring it to the clinic, whatever, and they will actually test it. Lyme disease is only carried, I believe, by deer ticks, which is a very specific kind of tick.
Reservoir. Mm-hmm.
And some of the other ones carry diseases are known as the Lone Star tick, which is another one that's very big in New York State for some weird reason too, even though it
came up from Texas.
After Texas, right. Somebody had a pet tick and they let it go.
And the good thing about Doxy is that it can also clear up your acne. So
there
if
you
you have acne,
that's right.
And you have some Doxy around, you can always self-medicate.
Minocycline is in the same family. By the way, if people are on those medications for rosacea or for mild acne, even at those very low doses, it also is photosensitive. So you have to remember that in the summer months up here in the Northeast, or if you're somewhere where there's sun all around, you have to be really careful.
And that's very important to remember also because another very commonly used product for skincare, even though it's not related to tick bites or anything, is retinol products and Retin-A, which
very
is even stronger. Exactly.
Right.
And so you really have to, when we give any sort of advice to our patients in terms of skincare and what Retin-A and retinol do, retinol to a lesser extent because it's much less potent than Retin-A, which you still need a prescription for, is they sensitize the skin, and so they help with skin turnover by irritating it. They also make it more photosensitive, which means that when you are in the sun, you have to be even more cautious about using sunscreen, using an SPF of at least 45. The kicker obviously is always reapply because people will put it on in the morning and they'll say, oh yeah, I put it on, first thing I do before I leave the home or when I get up with my toilette, put sunscreen on, but that will wear off after a while. La toilette, when you get yourself primped, ready.
Let me just straighten this out for you and the listener, by the way. So we're in America right now, and when you say...
I don't know how to say it in...
Toilette. A bon vivant like me will think of eau de toilette.
Right. Exactly. That's where it comes from.
Yes, but let me just tell you, the average listener out there is thinking of... Dr. Hutchinson just said when she's done using the toilet... She then does... Yes, I'm sorry. Okay. I know.
Well, let's put 2 T's
You're
and an E on it.
You're extremely sophisticated. Put 1 T on that toilet.
Can we do...
If you're going to use the word toilet.
Can we educate, since we're here to educate...
And debunk it?
And debunk and demystify?
I don't know. You got to D something. You got to D-toilette that thing you just mentioned to the listener because they're like, what?
The toilette.
What kind of show is this?
As a plural noun means the toilet. But la toilette is when you clean yourself up and put some perfume on.
In Lyon.
Right.
But not in Queens.
Yes. So now everybody has learned a new thing. There's a difference between...
I've learned a lot about it.
There's a difference between singular and plural. Just like between pronouns.
Well, there is a phrase in medicine. Pulmonary.
I thought you were going to say in Lyon.
Pulmonary toilet.
Exactly. See?
Yeah, but that's for us
Cleansing.
egghead doctors. You say pulmonary toilet, somebody's like, what do my lungs have to do with the toilet?
Okay.
So it does mean to clean.
Enough bathroom talk, as they say.
Seriously. When are we going to get to food and drink and you're on the toilet?
Nobody's on the toilet. People need to remember to reapply sunscreen, and also that
This is Plastic Fantastic with Dr. Olivia Hutchinson.
And Dr. Robert Silich.
Yes.
The efficacy of sunscreen will decrease over time. So you have something that you found in your cupboard that has been sitting around for 5 years, and it says SPF 75. It's definitely not a true SPF 75. It's probably still potent to some degree. I'm not saying
Still smells good. It smells good. Use it. That's what I say.
Especially if it has zinc in it, then it's going to stay white. By the way, if you have an email that you'd like to send us, or a question to ask, or a comment, please email us at plasticfantasticshow@gmail.com. That's plasticfantasticshow@gmail.com. We're just scratching the surface.
Oh, that was a good one. I like what you did there. I like that very much.
Of bug bites and other injuries.
What other kind of bites? All right, so we did ticks. What other kind of bites? Spider bites,
which again we don't really see. I mean,
they can be
snake
kind of
bites,
nasty, though.
Those are also, and the best thing to do is make sure that you go to the emergency room ASAP, unless you are knowledgeable in how to treat these, because in some cases you want to apply ice, in some cases you want to apply heat, tourniquets, all those various interventions, first aid interventions. And if you do the wrong thing, you can actually really hurt the person, especially if it's a limb, an arm or a leg, where you can cut off blood supply or where infection can set in. So thankfully, we're not in Australia. We're in New York City, where there are maybe 0 snakes. When was the last time?
That's true, but we do
Other
have...
than the zoo?
We do have common garter snakes that you see. They're not poisonous, but they do have them in Florida, and they have them in the southwest of the United States and the south. They have the cottonmouth and copperhead rattlesnakes.
The rattlesnakes, yeah.
It's pretty bad. But yes, thank God they're only at the zoo here.
Or the asp.
In Egypt?
Yes. We have to,
Yeah, I mean, seriously, that's
some...
way too sophisticated references now in the first segment. Can we get to hot dogs and French fries? My God.
The first segment.
Get it all out now. My God.
A minute away.
La toilette, asps. They're going to be like, what language is she speaking? You realize this is primarily audio. There's no subtitles on this. But they're relying on me, the moron, to translate. That's not good.
You have a very solid education, and your parents, I'm sure, were very happy with where you went to school.
They were, but you know that means nothing about being a moron if you went to a great school. No offense.
Yes, but in your case, it does.
I appreciate that.
Yes, make sure that you don't disparage yourself too much. Nor do I have.
Somebody's got to be disparaging on the show with all the asps and toilettes running around here. All right, can we take a break and come back and talk about food?
No, so the other thing we want to talk about, one more thing.
You need to share that clock with me.
Oh, okay.
The timer. Yeah, I know.
30 seconds.
Okay, quick.
So the geographical location, because we were talking about all these different things, and there's Coxsackie virus, the Norwalk virus.
From Coxsackie, New York.
Exactly.
That's right.
There are all these things that have names associated with them.
Good one.
They really don't just belong in those geographical areas.
Ebola.
There we go. See? It's come a long way.
Good one.
Well, shall we say the COVID? That one too. That one came from far away.
Yeah, but you're not allowed to say that.
Well, we can say where it started. It started in Wuhan. Everybody knows it started in Wuhan. But, the details shall remain murky at best.
Correct.
In any case, we are now at the end of our first segment.
So we're going to talk a little bit about food and drink and summer when we come back, but we're still in a little bit of injuries. You're listening to Plastic Fantastic with Dr. Olivia Hutchinson.
And Dr. Robert Silich, and we're going to be right back.
This is Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson.
When I have an asthma attack, I feel scared. It's like tiny nails in the air poke my lungs. I start to cough. Sometimes my parents have to take me to the hospital.
Today, 1 out of 13 children suffer from some form of asthma, accounting for nearly 1/3 of all emergency room visits.
I feel like I'm choking. It's kind of like an elephant is on my chest. A little whistle sound comes out when I breathe.
But while your child may suffer from asthma asthma doesn't have to make your child suffer. You know how to react to their asthma attacks. Here's how to prevent them. Log on to www.noattacks.org or call your doctor. www.noattacks.org. Because even one attack is one too many.
I feel like a fish with no water.
Brought to you by the EPA, the Ad Council, and this station.
To some people, the sound of a baby babbling doesn't mean much. But that's not necessarily true. By 6 months, they're combining vowels and consonants. By 9 months, they're trying out different kinds of sounds. And by 12 months, their babbling is beginning to take on some meaning. Especially if there's no babbling at all. Little to no babbling by 12 months or later is just one of the possible signs of autism in children. Early screening and intervention can make a lifetime of difference and unlock a world of possibilities. Take the first step at autismspeaks.org. A public service announcement brought to you by Autism Speaks.
Plastic Fantastic.
I'm going to repeat what I just said at the break. You need to read the room as the Bedrocks do. One of my favorite bands, by the way. You need to read the room. The audience out there, when you're saying La Toilette and Asp, they're thinking of something.
We do not need to go back and revisit those words.
It was good, though. I got to
like
say.
that?
I learned something every day.
As long as it makes you smile, makes my day.
Everybody,
So
imagine what I learn when the microphones are off from Dr. Hutchinson. Incredible, the amount of
It's a
information.
plethora of
There's a lot of stuff. Anyway, so we talked about tick bites and spider bites and hopefully not snake bites.
But other bites. Shall we talk about...
Want to talk about rabies?
Yeah. So vermin bites, but also just dog bites, which are probably much more common in terms of what we see here.
Larger
in the
mammals tend to carry rabies. Smaller rodents,
Raccoons.
believe it or not, do not. Squirrels do not carry rabies. Raccoons do, and dogs do.
And they don't always manifest the symptoms, because I know that sometimes they say, well, if it didn't act strange, then you're okay. But
Right.
that's, again, not the correct way to go about it. Dog bites, on the other hand,
Let's
if
talk
it's
about that, 'cause that's pretty
domesticated
common.
animal, you really
Right.
don't see rabies or rabid dogs, rabies-infected dogs. But we do see quite a few dog bites. And I forget which month. Is it May that's dog bite? There's a month that the American Society of Plastic Surgeons...
You kidding?
designated as dog bite
Dog bite month?
Yeah, just awareness, dog bite awareness. Not like encouraging dog bites. Not like take your dog out and
Take
see
your dog
who you
out
can
and
bite.
see if you could bite somebody. So dog bites are very interesting because there is something that happens in dog saliva and in dog bites that is not necessarily an infection, but something known as a histamine response, which is a big, red, warm, blanching rash that usually happens within 8 to 12 hours and sometimes maybe 24 hours after a dog bite. And that's known as a histamine response. And people always call the next day and they say, oh my God, it's infected, blah, blah, blah. It's not necessarily infected, but you do need to be on an antihistamine such as Benadryl, which is over the counter. So Benadryl also, by the way, is another one of those great medications I think that every household should have probably all year round, but particularly in the summer. It's good for mild rashes. It's even good for sunburn, believe it or not. It's very good for dog bites because you do get this histamine response. So people ask you and I this a lot. Why do we not close dog bites?
Because we're at the beach sunning ourselves.
That's the answer I was looking for. Tell her what she's
too
won.
lazy.
Okay.
Behind door number one.
No, it's because of the high bacterial content. We do worry about closing a wound. Wounds are safer open than they are closed in terms of an infection. Now, the big exception to that, dog bites or human bites, God forbid, around the face, around the eyes, obviously. Something where it would be significantly disfiguring needs to be obviously washed out, loosely closed, sometimes debrided, which is the fancy medical word for removing
There you go.
dead tissue. There I
Gotta
go.
read
But I didn't do
read
the
room.
French. I didn't do the French pronunciation.
Well, it's a
of
French word already.
debridement.
So, you know, yeah.
Right. Anyway.
You even put the accent on the last syllable.
Did you like that?
Yes,
I did
love
it for you.
That's great.
Trying to get you
Okay.
excited over there. So
About
that's the
dirty
that's the
wounds?
dog
That'll
bite
do it.
thing and human bite thing. They're very, very dirty by nature. Dirty meaning bacterially dirty. We do not like to close them if we can avoid it. If you must, like all lacerations and cuts, we kind of think they need to be closed within 6 hours. Some of the facial ones can wait a little bit longer if you can't get to an emergency room or to a doctor. But we like to do that within 6 hours before the bacteria gets what's called colonized on the skin and in the wound, where then it becomes way too high a bacterial load to clear it with a closed wound. So that's kind of the quick spiel on dog bites and human bites.
And definitely dog bite, by virtue of what it involves in terms of it's not a clean cut, it's not
a crush injury usually.
Exactly. It's dirty and edges are irregular. There can be particles of, whatever dirt or other things embedded. Similar to trauma that happens, again, from a lot of people traveling in the summer. If you are unfortunate enough to be on a motorcycle or to fall even off a bike, if you fall in the park or on the pavement, you can have that in-ground dirt that can almost cause a tattoo.
Traumatic tattoo, right?
Exactly.
Which we've talked about.
So anything like that really should be seen and evaluated by a plastic surgeon. We, of all the specialties, really have the best training when it comes to wound assessment, evaluation, and management, and determining what the best course of action is. There are obviously some very qualified doctors in the emergency rooms in various places. That usually falls on the doctor's own ability to determine what their comfort level is and see if they feel like they need to bring in a specialist. But certainly if you have the option to at least have that initial consultation or evaluation by a plastic surgeon, I think that's definitely worth at least peace of mind. I always say, just come in. It's also something that's very difficult to evaluate over the phone or via video. You really need to have that.
Nowadays people do send photographs a lot, but nothing really is better than examining somebody.
And also that's sort of interesting what's happened in the past couple of years because of the inability or the recommendations for patients and for people not to be in the same room together. There's been a much higher reliance on photos and telemedicine, and it really only works to a certain extent. I mean, for what we do, the vast majority of the time, having a video consultation is very limited in terms of the information it can provide and certainly in terms of the information we can provide for the patient comfortably in terms of telling them what needs to be done and where we think the best course of action lies. So dog bites, very important to be seen. There are certain breeds that are associated with more aggressive behavior, and I think that's changed also over the course of the years. Not all the big dogs are horrible and not all the little dogs are safe. So
right. Those really little guys can cause some damage.
Yeah, the terriers and whatever. Anyway, it really depends on
Don't
the
pick
dog,
on the terriers.
I'm not going to pick on anyone. I'm not going to pick.
By the way, you're listening to Plastic Fantastic with Dr. Olivia Hutchinson
and Dr. Robert Silich.
You could email us at plasticfantasticshow@gmail.com. Summertime, 4th of July, we talked about. Should we talk about burns? Do we have time?
Yeah, absolutely. Because you also mentioned rashes, and I think that's another very common. People are out gardening, sun exposure, handling plants that they
again, Benadryl cream, antihistamine, some over-the-counter steroid creams.
There are also these other things like just much more like calendula. Calendula, the topical.
Isn't that the Roman Empire, the Roman emperor that had that
now you're going
orgies and all that stuff?
That's Caligula.
Caligula. That was close.
He made a cream for all his.
Don't go there.
Okay, no.
I don't even know. Just next.
Itch X is another. Ivorex.
Phrasing.
All these things. They're just over-the-counter things. Even if you don't have access to.
Poison ivy, poison oak.
Yes.
Poison.
Sumac is another one.
What is that?
Who knows? I don't know. I don't
Do
garden.
you cook with it?
Is it
Who
a
knows?
spice?
They had it at the farmer's market. I didn't buy it. It was too expensive.
I fed it to my cow.
And now he's itching.
A lot of rashes are not particularly.
A lot of rashes.
They don't need to be evaluated immediately.
If it's wet, dry it. If it's dry, wet it. That's what they teach you. That's right.
But they can be very, very upsetting too if mosquito bites. And again, it has to do with that histamine release that you were talking about. So things that will decrease the histamine response will generally help. And burns. Let's talk about burns.
Yeah. So very, very quick, easy way to remember burns. People always ask, is this first degree, second degree, third degree? First degree is a sunburn. Skin is not broken. It's just red. Second degree is anytime you see a blister. Third degree is a little bit more complicated. It has to do usually when the skin itself is completely burned through and now you're on the what's called subcutaneous tissues. What's more in vogue today, or probably more scientifically correct, is to say things like partial thickness or full thickness burns. The first, second, third degree is probably pretty much outdated today. Although, very quick, easy way to remember it is a first degree burn is a sunburn, second degree is a blister, and third degree is full thickness. Full thickness burns need to obviously be seen instantly at an emergency room. They are an emergency room, how tiny it may be. The second degree burn depends on the size of the blisters, where the blisters are, if they're on the face or if they're on a joint crease or something. That's a big deal.
And then this question comes up all the time. Yeah. What do you do if you get a blister? Do you leave it intact or do you get rid of it? Do you unroof it, as they say?
I think if they're really big, intense, you should absolutely break them. The problem is this. Once you break them, the skin is now open. You now need to put something topical on there. The best thing in the world is something called Silvadene, which is a type of antibiotic ointment that you need a prescription for. Otherwise, Neosporin, bacitracin are very good only on the open areas. Do not put any antibiotics or anything on burns that have intact skin. That's where you get problems. It's got to then be taken off and all that other stuff. So basically, those are the big three things about burns.
And when in doubt, call your plastic surgeon.
Call the doctor. Absolutely. And plastic surgeons, by the way, burns fall in our purview. People may not think of that, but that is one of the things that we do all the time. We have extensive burn experience, you and I. I was in a burn unit for many years as one of the burn doctors, and it's a very fascinating field, but not to be taken lightly, obviously.
And thankfully, most of the burns that we see nowadays, unless the patient's already admitted into a burn unit with severe burns, say from a fire,
Right.
God forbid, some horrible thing of that nature. Also, we were talking about July 4th and fireworks or anything where there's a very high heat component as opposed to just oil splattering or things related to cooking at home, boiling water, that kind of thing. It's very important to address those things immediately. And also remember that if you're out in the sun, since we were talking about sunburns, not only do you need to apply sunscreen and reapply frequently, and of course, if you're going to be out splashing about in the water, if you're at the ocean or in the pool, that's going to lessen the amount of time that the sunscreen is effective for. The other thing to remember is that once you come out of the sun, your skin will still continue to show the signs of that exposure from before. So you're going to continue to get more red if you're getting a burn. So don't wait until you're starting to turn pink, because that means that you've gone way past the safe
Yeah, I think with sunburns,
limit.
inflammation peaks at about 12, 18 hours after, sometimes 24. Right. So that's a very good point. If you see redness outside in the sun, it's time to get in.
Right. That's not the indicator that you should be going
By the way, we didn't mention rash guards, but that's why those things are great. They didn't have them when you and I were kids, but they have them now. For the kids that don't like cream, or anybody who doesn't like putting cream on and off, they make these SPF rash guards and shirts and T-shirts.
You mean like those long-sleeved?
Yeah, and they have SPF 80 on 40
They look like
or
surfing
whatever.
outfits, right?
Surfers use them all the time, yeah.
Did you see that little video of the guy surfing with his dogs? This Australian guy.
I don't know. There are a lot of dogs that surf. It's unbelievable.
Yeah. This one's a little bit older, but he had
Better
two dogs.
better than I surf, that's for sure.
I don't know. Maybe my dogs surf. I'm never trying it.
That's right.
Maybe it's one of those innate things. All right. So we've covered a lot of these things that have to do with injuries. There are also bizarre things. Well, bizarre for New York City. Shark bites. We don't really see those very much. Really scary things of that nature. And
although it's Summer of the Shark, we've seen a lot of stuff about Long Island. And
Long Island has
Cape Cod. There's a lot of shark sightings.
Well, they're there all the time. And then, of course, in different parts of the country and the world. You were mentioning Florida. I mean, when have you seen those aerial shots from the satellites or drones? And
with
you can
those
see
black shadows?
Yes, they're so close to the beach. It's not like they're only way out if you're doing deep sea diving or something.
Cool.
So they come in to feed closer. So shark bites, generally, again, very rare, but important to stop the bleeding and get them emergency treatment. Pretty obvious there. And don't go in the water if you see them.
That's right.
The original Jaws. What year was that? 1970 something?
I would say 77.
I think that really changed the way that it certainly had a huge impact on.
Great movie.
Right? And didn't it come out right in the summertime? There was something about the release of it that was
I thought it was terrific.
So it was really good.
It's still good.
And if you go down to which studios show you, they have the original shark that they use.
Oh, right. I think it's Universal.
Universal Studios.
Where the shark comes up out of the water on the tour.
And you see how fake it looks, and it's like, oh my goodness, this is what was so scary.
Wasn't that fake in the movie, though? They hit it pretty well.
I know. And it was one of those movies where I think some of the actors didn't get along. It went like over time, over budget.
Right?
Everything went wrong. Yes, it was pretty funny.
There were some pretty good actors in that movie, though.
When we come back, we're going to talk more about food.
Oh, thank God.
Drink.
No more rashes
movies.
and bites and burns. Good.
Maybe some music. You're listening Plastic Fantastic with Dr. Robert Silich.
And Dr. Olivia Hutchinson. We'll be right back.
Don't go anywhere. Plastic Fantastic will be right back.
The study in the American Heart Association's journal Stroke shows that people who work more than 10 hours a day for at least 50 days per year have a 29% greater risk of stroke. And if they do it for more than 10 years, their risk of stroke rises to 45% greater, according to study author Dr. Alexis Descatha.
The association between 10 years of long working hours and strokes seem even stronger for people under the age of 50. This was unexpected. We need further research to explore this finding.
Discatha notes that healthcare providers are among the most guilty of working long hours. He says he'll advise patients to work more efficiently and plans on following his own advice.
For more or to get involved, call 1-888-4STROKE or visit strokeassociation.org. Follow the American Heart Association on Facebook and Twitter, 888-4STROKE or strokeassociation.org.
Why is Connor having trouble focusing in school?
Having trouble finding Connor's middle school? Would you like directions?
No, why is Connor having trouble focusing in school?
Finding lowest airfare to Istanbul.
No, I'm tired of fighting with him over homework.
Home, walk, restaurant. Need a review?
No, I need help. He's very smart, but his mind wanders. He's disorganized.
I think I understand.
Oh, good.
Finding best potatoes for French fries.
No!
Russet, fingerling, Yukon Gold.
Why don't you understand me?
Sorry, I was trying to show how Connor feels every day. Frustrating, isn't it? Redirecting to understood.org.
For the 1 in 5 kids with learning and attention issues, this is what life can feel like. Explore understood.org, a free online resource about learning and attention issues, designed to help your child thrive in school and in life. Understood.org, because understanding is everything.
Brought to you by understood.org and the Ad Council.
Never miss an episode. Download Plastic Fantastic on Apple Podcasts, Spreaker, or wherever major podcasts are found. Simply search Plastic Fantastic. Now, here are board-certified surgeons Dr. Robert Silich and Dr. Olivia Hutchinson.
Welcome back to Plastic Fantastic with Dr. Olivia Hutchinson.
And Dr. Robert Silich.
We're talking about summer injuries.
We're done talking about summer injuries.
I was waiting for you to say that. What are we going to talk about then? Food and drink?
Yes. Well, we can sort of segue into that with maybe injuries that are not specific to the summer, but cooking-related injuries.
All right. Scalds, burns.
Scalds, burns, and then those slicing, what are they called?
Those mandolins. Those things. We've seen that all the time. Not much to do for that, by the way.
Yeah. If you have the missing tissue, bring it in. But other than that,
even that, it's usually used as just kind of a biological dressing when it happens, because the mandolins, they slice things so thin that usually it's not something that's viable to be put back on.
And we're not talking about the musical instrument.
No.
We're talking about the cooking instrument, which is, I don't have one. I mean, I just use a knife. So.
I do have one. But they're not...
Have you ever injured yourself? Isn't there supposed to be a guard on it or something?
There is, but the guard makes it hard to use. But I'm such a chicken. When I get like halfway down to whatever it is, I just will throw it away and just stop.
So your thumb doesn't get close. It's the thumb usually that gets sliced by that
they're
thing.
so sharp and it happens so quickly.
Okay. So steer clear of mandolins.
Steer clear of the mandolins.
Any instruments you're not familiar with, do not use. Burns, we talked about scald injuries and superficial burns. Like, thankfully, they tend to not be particularly, because they're a splash injury, so they tend to not be quite as deep as some other things. And then
the
ice.
Oil injuries, the hot oil tend to be a little bit worse than the water-based injuries because the oil will stay on the skin a little bit longer. So it's always good to rinse that off if you can with cool water. All those other little home remedies that you hear about, yogurt.
Just because it's cold?
I guess. Butter, none of that stuff works. In fact, most of that stuff makes it worse because in order to clean it and to do good wound care, you've got to wash all that stuff off, which is incredibly painful.
But ice works.
Ice works, and aloe is actually not bad because it's water soluble.
And then the last little hint or piece of advice is don't put anything on that might stick to the wound. Yeah. So people sometimes will put like tissue paper or something. They don't have gauze.
Or just a gauze that's a non-adherent gauze, because regular gauze can be really, really horrible too.
And if you do have something that's stuck, try to get it wet. As you were saying, if it's dry, get it wet. And then wash it off so that it peels off more easily. So otherwise it's going to be more painful. And we're not in the pain industry here.
We're not,
so
we see enough of it.
That's a whole other topic. We're not going to go down that road. So that's cooking related things. Otherwise there's the usual stab injuries where you're holding something in your left hand or whatever, the other hand.
we moved from the kitchen to gang related injuries. I like that.
Like,
that's
an avocado or whatever.
Yeah.
When you're holding something and you're trying
the bagel injuries.
The bagel injuries. injuries,
Right.
all those things where all of a sudden the knife will slip and then it will end up puncturing the hand on the other side that's holding whatever it is.
So they make bagel cutters, which are good. A serrated knife is always better for something like a tomato, or as you say, tomato. Definitely a serrated knife is good for bagels or any kind of a type of bread that's got a firm crust, because those knives slide all the time.
Hand injuries are a specialty of plastic surgeons and orthopedic surgeons. So there is a subsection, a subgroup of both plastic surgeons and orthopedic surgeons who will manage hand injuries. It's such a complex, I don't think people really realize, I don't think I realized it until we actually were studying it, between all the tendons and ligaments and neurovascular structures there. Very, very important to make sure that that's managed appropriately and in a timely fashion. So if you have a hand injury, make sure that you have a hand surgeon, unless it's truly just a superficial thing. But the examination is very important. Make sure that nothing is missed. The management, obviously, is also extremely important. And there are hand surgeons, like I said, so important to remember. You should at least ask to be evaluated by a hand surgeon if there's any doubt, primary physician's evaluation or when they consult with the patient. And because also they can be treated relatively well. I mean, it's something like, a tendon laceration can be fixed and you can have a great result, or you can have permanent damage and then secondary deformities that happen from that.
If you miss those injuries, if you think, oh, it's just nothing, I'll just bandage it up. You got to just be really sure about that. So it's always good to communicate with somebody, even if it's just by phone. They can describe the kind of injury. It'll help us.
Leave it to the professionals, as they say.
Exactly. Don't try this at home.
All right. So now that we're done with, sorry.
What you should try at home, though, is what you're about to talk about.
Try some wine at home.
All right. What have you been cooking this week? This is the big thing.
Grilling is,
Where
important.
are you grilling?
Well,
I don't get it.
You go out of the city. It's easier if you go out
So you've been out of the city grilling.
I will just take credit for food that other people make for me. If you go to a restaurant and they make you something, it's kind of like you made it yourself.
And they made it on the grill. You're like, I grilled the steak last night.
I grilled the fish. See, I don't make fish at home because it just makes everything. Yeah, I like to eat it, but it just makes the smell is too much for me. So
we got to talk because there's ways to do it without that.
Tell me. I'm listening.
Well, what kind of fish are we talking about here? Are we talking about like oven roasted fish, or you want to make something like seafood salad?
Well, if it's cold, then, but you still have to. Ceviche, I guess you can do it.
I made ceviche this weekend.
I
Isn't
know.
that funny?
Yes, you're an inspiration to us all. If only
sometimes
we
in
could.
the hot summer, ceviche is a great thing. It's
you even
really
told me what
easy
you did
to
for
do.
your marinade, lime concoction.
And the little trick about onions and shallots, which is put them in a little Ziploc bag with lemon juice and massage it a little bit. It takes the sting out of those fragrance of
first?
them. Yeah, or you can leave it in like strips or whatever.
Does lime juice work also, or it has
No,
lemon?
I think you could use lime too.
Either
but
one.
Lime is better, I think, as the overall citrus that's going on in the ceviche.
Yeah.
So what did you grill?
Unfortunately, I don't always have both lime and lemon. So, for those of us who have to
I'm
make
surprised
do.
because I would consider that part of your bar, which I know is well stocked.
I try not to run out of anything ever, of course. Well, fruit has been really wonderful at the farmer's market. So heirloom tomatoes, which
They've
you don't
been
grill,
really
of course,
good right now,
but they've been outstanding. And
Did you try my sandwich I talked to you about?
I didn't.
Oh,
Tell me again.
Get a good piece of sourdough, grill it, or
that's the problem. They did
toast
not
it.
have sourdough bread at the farmer's market. That's probably why I didn't do it.
Mayonnaise, salt, pepper, and
I do have mayo now.
heirloom tomatoes.
Yeah.
If you want to put some basil on it, you can.
Yes, they have basil. Basil.
So I say
Art
basil. Art basil on my tomato. Really. But you know what? I was at the farmer's market this week too. You go to the one on 14th Street?
I've gone there. There's one on the Upper East Side, which is a little bit closer to me.
It's the same people, right?
Yeah, and there's one on the West Side. Actually, there are two, I think, on the Upper West Side. They have different days. So if you can't go on Saturday, you can go on Friday. Some of the people are the same. I mean, they're not the people, but, the farms are the same that deliver in the various places. The berries were amazing, but now we're past the strawberry season, so we have to, I mean, at least I think the locals.
It's not yet corn season.
Oh, they did have corn. First time
but
they had corn.
I don't think it's that good yet, though.
It was pretty good. Anything
Needs a
for
little
the
bit
market.
of time.
So that's one of the things we always talk about is how good the food is because it's fresh. All of these things that you get from the farmer's market.
Eat seasonally. It's the way to go.
Tastes so much better, even with very little done to them.
Absolutely.
Right?
I agree with that.
A little sea salt.
What do you do with your corn?
Olive, boil it, or I grill it, or I just,
Do you boil it and then grill it? Or will you grill it raw?
If you have time. It takes a little bit longer, I think, if you just leave it on the grill. But I don't
call it maize.
Maize.
Do you remember that commercial?
No.
That was a commercial in America, we were kids about, I don't know, some kind of corn.
Fiasco?
No, they had this Native American woman who was obviously an actress who would come on and say, we call it maize. And I think it was like some kind of corn-based, maybe it was corn oil or something, or some kind of butter.
Oh,
anyway.
Correcting the use of it?
Yeah.
I like the two-tone corn, the yellow and white. I think the white corn is usually a little bit less flavorful. Same with asparagus. They've had some really good asparagus.
Asparagus has been very good lately. They've had those little pencil ones.
Yes.
Oh, man, those
that's so great.
Good.
Grill that too. Grill everything. Evu, right? The olive oil thing. I don't know if you're supposed to.
That's pretty good.
Is that the way you're supposed to pronounce the?
I don't know. I always say olive oil. It's a very boutique kind of.
It's the extra virgin. So that's the EV.
Absolutely.
And then the 2 O's after. Balsamic, I like also.
What's been your summer cocktail?
So, I've been trying out different things. And one of the nice things is that there are all these places now, restaurants, and I guess bars with the restaurants, that have done variations on a theme. So
like an actual
little twist.
Signature cocktail.
Yeah. They come up with interesting names for them.
Like
so, the Cosmo,
your go-to drink, which I told
foremost.
you, I love the fact that you kept going with that.
Yeah. Well, it's going to come back in style at some point.
I just think it never left style for some people like you, which I think is wonderful.
So you got to stick with what works, right? So the Cosmo, but they'll add little either liqueurs. I'm always learning about these new liqueurs. There are a lot of these herbalist type things where they have names that I can't remember.
That's been a big thing in gin lately too, is the herbal gins, which I'm not a big fan of.
Well, sometimes they really do taste medicinal, which is not great.
Too much.
Unless maybe it's done on purpose to remind you that alcohol and a drink can have medicinal properties that are either good or bad. And you might need
Speaking
to
of
keep
herbal,
in mind.
at Wimbledon, which was just this past week.
That was quite the match.
It was amazing. They were a lot of Pimm's cups, which is a very British drink, which is based on a type of gin. It's a type of sweetened gin, I think. Pimm's, that's what that is. It's an alcohol that's not very high in alcohol content, even though it's based on gin, but the base liquor in it is gin.
What's the normal alcoholic content of gin? Is it 35 or 40%?
It's like up there the way any spirit would be like.
I love how they call it spirit.
Spirits, right, exactly.
It'll lift your spirits, hopefully.
Exactly. Whereas this one is, I think a Pimm's cup or a Pimm's liqueur is down at like 12, 15.
So it works with the strawberries and the cream
and
in the morning?
Yeah, you usually have it right. You have it first thing in the morning with your cornflakes.
It certainly makes the tennis much more entertaining.
It certainly does. No, it's quite good.
Have you been to Wimbledon?
It looks like iced tea. I haven't, no.
Really? You go to London all the time and you haven't been to Wimbledon?
Yeah, but I've not done that. I don't know why. That seems a little too fancy for me.
Oh, okay. Maybe you'll have Wimbledon come to us. Well, the U.S. Open
certainly looks nice, and the weather's been spectacular.
Yes, although we've had a very nice stretch of weather here, too.
We have.
Europe, I think, got blasted a couple of weeks ago.
With heat?
Where they had horrible, we were talking about burns and heat stroke. We didn't talk about heat stroke. It's not really a plastic surgery injury, but related, obviously, to dehydration and sun exposure. And sometimes you get the sunburn associated with it. Yeah, they had a couple of weeks, I think, where it was intolerable. And so it's nice that things have become a little bit more bearable and more enjoyable.
And for all its charm and love that I have for it, they're not very big on air conditioning over there.
Yes, well, Europe in general, right?
I think they didn't have to have it. I think that's why. It's not like they're kind of not with the times or that they're not advanced.
Do you bring your own little AC unit with you? Because I think you like it when it's nice and cool.
I like it when it's very cool, but they're not...
Some like it cold.
That's true.
A new movie with Dr.
Rob Silich. That's right. But I have to say, over the years that I've been going, it's gotten better and better and better every year. And whenever they renovate a hotel or there's a new hotel, it's always like perfect the way it is.
But that's probably because there's so many Americans who travel and who probably can't
complain. They're sick of hearing people complain. I want more ice in my drink and I want more air conditioning.
Definitely more air conditioning, especially at the museums, because there you can have throngs of people.
That is rough.
I think there's a serious issue with overcrowding at these places.
But even in like a fancy restaurant, if you go out to dinner sometimes, if a man's got a suit and tie on, and you could really be dying in there.
That's going to be our next topic of conversation. Why is it that the fancier men's outfits require more clothing, whereas the girls require less?
Exactly.
Right?
That's right.
That's a difference of wardrobe.
Very good observation, Doctor.
One of the many I will gladly share. Things that pop up in my mind. You've been listening to Plastic Fantastic Show.
We're not done.
We are?
Come on.
Yes.
See, we spend too much time on medicine.
Yes.
I want to start with food and drink
We
next
can
week.
fix that. Food, drink, and fashion.
Well, we didn't do movies yet. Summer movies. Come on.
Too. Well, we can do that next week, too. It's really only the beginning of the summer. You've been listening to Plastic Fantastic with Dr. Robert Silich.
And Dr. Olivia Hutchinson. We've only just begun, in the words of Karen Carpenter.
And if you'd like to send us an email,
please do so at plasticfantasticshow@gmail.com.
And have a great day.
You've been listening to Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson. Produced by Mike Scheck. This is Bill Eugene speaking. Got a question? Email plasticfantasticshow@gmail.com. And be sure to listen right here every week for another episode of Plastic Fantastic with Dr. Robert Silich and Dr. Olivia Hutchinson.